Why you shouldn't wait longer than 6 months to have your hip or knee replaced. In 6 minutes or less, I'm going to show you why you shouldn't wait too long for a total hip or knee replacement. I'm Brad Logan, founder of Total Joint PT, and I'm your physical therapy specialist for total hip and knee replacement. I've successfully helped thousands of people rehab their new joint after surgery. In every video, I'm going to give you one tip or strategy you can use to get the best possible results after surgery. Are you tired of living in pain and not able to do the activities you love because of your hip or knee pain? Living with this pain affects all aspects of your life, and when you find out from your doctor that a total hip or knee replacement is inevitable, one of the toughest decisions to make is knowing when is the right time to have this surgery. You don't want to rush into it and get it too soon, but you don't want to wait too long and remain in pain if surgery is your best option to get back to the lifestyle you want. Most people try to postpone this as long as they can, and that is a good strategy up to a point. Sometimes people are worried about getting it done too soon, thinking that they might wear out the new joint, but that is no longer a concern. Modern implants are expected to last 25 to 30 years, and if you do end up wearing it out and need a revision in 30 years, you probably won't need to replace all the hardware, just the wear and tear components, which is a much easier surgery and recovery. But the longer you wait, the worse it gets. The more pain meds you take, your activity decreases, your overall health suffers. Your recovery after surgery is tougher, and if you wait too long, you risk not getting back to the lifestyle you want. Arthritis typically has a gradual progression. Some people will notice accelerated changes, but it's still not overnight. Let's look at the knee specifically, for example. As the arthritis progresses in the knee, it eventually leads to an increased joint deformity like bow legs or knock knees because the bone starts to wear away. In the hip, waiting too long can cause the leg to shorten as the bone wears away. In either of these cases, your surgeon may need to do a more extensive surgery to correct the deformity and use more specialized hardware, which may result in more permanent limitations after surgery, which means you may have to cross a few of your favorite activities off your list for good. Also, if you wait too long, you'll have more advanced changes to the soft tissue, including the muscles, the tendons, the ligaments, and joint capsule from the chronic inflammation that may not fully reverse after surgery. Looking beyond the specific issues to just the hip or the knee, it also affects your entire body, causing even bigger problems. The increasing pain will cause you to change the way you move, compensating to try to decrease your pain. But then you start to move in a way that puts extra stress on other parts of your body, leading to issues with the other hip or your knee, or even your back. Plus, you're decreasing your physical activity, which can lead to weight gain, decreased endurance, cardiac issues, and just an overall downward spiral for your health, not to mention taking all the extra pain meds in the process. A research study from the Journal of Clinical Orthopedics and Related Research found that people who waited longer than 6 months to have their surgery experienced smaller functional gains afterwards. So if they waited too long, their results were not as good. So it's important to get your surgery at the appropriate time. But how do you know when it's time? Here's some questions to ask yourself so you can determine when it's the appropriate time to have your surgery. Question number 1, how bad is your hip or knee pain and how much is it negatively affecting your life? More specifically, is it affecting things like your work, your sleep, your workouts, your mood? Is it keeping you from doing the things you love? Question number 2, have you tried all the less invasive treatment options first? Have you tried things like physical therapy, over-the-counter pain medications, ice or heat, activity modification, weight loss if appropriate, cortisone shots, viscose supplementation, or even acupuncture? One or more of these options might buy you some time so you can postpone your surgery without risking the potential for the best possible results. If you have tried all the less invasive options you feel are appropriate and your pain is still limiting your lifestyle, then it's probably time to consider moving forward with surgery. But if you're able to stay active, exercise, sleep, and do most of the things you love while keeping your pain under control without the extensive use of pain meds, then you could safely postpone the surgery until it starts interfering with your lifestyle more significantly. I created a handy checklist to help you decide whether or not it's time to get a total hip or knee replacement, along with information about the less invasive options to try before surgery. Comment yes below, and I'll send it to you for free. Start using this immediately to help you decide whether or not these less invasive options are right for you, or if it's time to consider a total hip or knee replacement as your best option to getting back to doing what you love. Comment yes below if you'd like to receive it, or share this with someone you know who is facing a hip or knee replacement.